Hi guys, Jason from Mr.Physio. First of all, I have to say sorry to you all guys because I haven't been making videos. Yeah, the pandemic has changed. Also, I've moved into new place, so there'll be no excuse from now on. I will make videos regularly and my full capacity. And today, I'm going to explain the root cause of almost every problem. So whatever problem you have, or whatever pain that is, you have to watch this video and let me know if that makes sense. So imagine there is a balloon in your stomach. And the rubber is core muscles. And these core muscles create some kind of pressure. That's called intra-abdominal pressure. The pressure within our abdomen. So this pressure will change depending on how strong your core muscles are. So if your core muscles are strong enough, that will actually maintain a certain level of pressure. But if the core muscles are weak, this pressure will go down. It's like you have like a flat, floppy balloon in your abdomen. So the balloon itself getting deflated if you have weak core muscles. And if you look at the position of the balloon, it's above your pelvis and in front of your spine and below the ribcage. Do you think this skeleton itself can stand alone? No. You have to get some support. And the biggest support in our body is the abdominal pressure. So when you have weak core muscles, what happens then? For example, your pelvis and spine can move forward because you don't have any support from the front. And more importantly, your ribcage is going down like that because the abdominal pressure itself acts as an air cushion. As you can see here, the ribcage doesn't have anything to support itself. So the air cushion have to support your ribcage. So if you don't have the strong support that bolsters the ribcage, your ribcage is likely to go down like that. And your shoulders and your head are likely to come forward. That's called rounded shoulders, forward neck posture. And it can give you a lot of, neck pain, shoulder pain, and even, elbow pain. And the same goes for your lower body. If your pelvis and spine move forward because you don't have much support from the front, first of all, you don't have your, hip muscles in a neutral position. So it can't really function 100% because it's out of its normal position, right? So if your hip muscle is not working properly, the other muscles below have to work harder and they will get overloaded, then they're likely to develop pain. You can easily check yourself. Just take a photo of yourself from the side and draw a vertical line. Then the center of your ankle, knee, and pelvis should be in that line. Most of you will have this bone sit ahead of that line, and that's not a good sign because that means your femur, your thigh bone actually stands like that. Okay, so if you have this stick a little bit leaning forward and you push down with some weight, it's likely to collapse forward like that. It's likely to go forward. The same goes here in your hip joint. The head of your thigh bone is likely to move forward, driving into that hip socket, potentially damaging that area. So you have to fix it. You have to work on your core, you have to work on your breathing because diaphragm itself is the roof of your core muscles. And I've got other videos about core and breathing, so please see the comment section. So today I've explained the root cause of almost every musculoskeletal problem. I hope it makes sense and gives you a better understanding on how multi-joint pain can be developed through this issue. I see you next time. Safe rehab.